Me live in studio. Remember, you can send me live your questions at KTN News at Akisa Wandera. The hashtag choose on Twitter is KTN Prime for easier tracking of your questions. You can as well send us a message on 22155. Any questions around Kenya's vaccination plan and general questions on the COVID-19 vaccine side effects. For those of you who have already been vaccinated, I believe Dr. Akhwale will have the right responses to your questions. Dr. Ari, thank you for joining us here tonight on KTN Prime. Perhaps let's just start off from what we are seeing in India on the 5th day running, breaking a record nobody wants, with more than 300,000 cases in 24 hours. Your thoughts?
Yeah, thank you. Thank you, Akisa, for hosting me and giving me the opportunity to talk to Kenyans about the vaccination plan. And really starting from the fact that in March, Kenya started experiencing its third wave. It was severe. It continues. We are not yet out of the woods. And even as we're experiencing that, we now get these reports that are really devastating, tragic indeed. What we are seeing is terrible. It's not anything one would wish to see happening. But we are living at these times when this pandemic is really unforgiving. It is unpredictable. But we have basics on how best to prevent it. And I think that really should be our guiding principle, that we should not let our guard.
We were depending on India for our vaccine supply, as Kenya and other African countries. About 41 African countries were getting their vaccine from India. They've slowed that down to deal with the crisis that they're currently dealing with. What happens to us? What then is our vaccination plan going forward with that in mind?
Yeah, yes, for sure. When India prioritized their domestic needs because of the increasing cases, that affected supply through the COVAX mechanism. It is important to know the limiting factor is the actual factory, the real manufacturing of the vaccine, and not so much the mechanism itself. And also just to note, yes, 60% of the entire world's vaccine are produced in India, and in particular, the Serum Institute of India, which has a capacity of I think currently 60 million, but they have just been expanding to 100 million doses of vaccines per month. So they can produce over 1 billion doses of vaccines in 1 year. Now, the reason should we be worried? Well, it has impacted, but it's good to know that even within Kenya, our deployment plan, we looked at getting vaccines from 3 sources. The first one is COVAX mechanism, which Kenya has already signed into, and where we expected to vaccinate 20% of the population through the COVAX mechanism. There is, however, the African Union also came up with a different mechanism, known as AVAT, and through that mechanism, they have been able to secure a number of doses. And as we speak, Kenya is in very advanced stages in terms of negotiating to secure doses through that mechanism. And then we also have an opportunity of bilateral negotiation with the manufacturers themselves. So, but what I would want to say, especially now, is that through the COVAX mechanism, they communicated to us last week, telling us that they have been able to secure 65 million doses that outside India, that they will be distributing during the month of May. We are waiting more details as to whether Kenya will be part of that and how many doses will come. Right. But that is one. But there's a very important fundamental thing about reduced production that people may have missed. One of the main reasons was access to raw materials. As all these things were happening, India could not get access. The US banned access of its critical raw materials for the manufacture. But yesterday, if you are very keen, then the US has lifted that ban. That means, therefore, the Indian factories can again start manufacturing. So a lot of things, a lot of moving parts within the supply chain and manufacturing. And for me, from where I sit, I think in the next few weeks, we should see improve in the supply.
Right. Let's get to some of the questions we got earlier from Kenyans and some that are still streaming in here. Idris Abdallah asks, does the government have certainty on when exactly Kenyans will receive the vaccine entirely? If not, what plan does it have for the citizens? And yet we know the hospitals are not well prepared to admit patients in case the worst hits, God forbid.
Okay, so thank you. First, let me start with the first cohort of 1 million Kenyans who will receive the AstraZeneca. As I've said, the COVAX mechanism has given us information that there was a delay. Initially, there was to be 2 shipments, one in April and one in May. But now they have told us we'll get our shipments in May. Okay. So there shouldn't be a lot of anxiety around that. You had over the weekend, we indicated that the second dose, we've rescheduled it to be administered at 12 weeks instead of 8 weeks. And there's no harm at all in that. In fact, the data that was presented to the World Health Organization that was used to provide emergency use authorization for AstraZeneca showed that administration of the second jab at 12 weeks gave a better immune response among those that were jabbed at 12 weeks.
Because I've seen this question severally. What happens if they have to wait a little longer?
If the data that has been analyzed specific for AstraZeneca, let me say, and later on we'll discuss because we are going to introduce multiple vaccines in Kenya. But for AstraZeneca, the response, the best response, a step back. Before they even collected all data, the initial data indicated that the second dose would be after 4 weeks. But when they reviewed data from their clinical trial sites and they looked at the immune response, they started seeing that the period between 8 weeks to 12 weeks was the optimal. And that's why in this country, we chose to start with 8 weeks for the reason that it is short enough for people to remember to come.
Right.
That was one. But we knew, and at that time we expected a regular supply of the vaccines, but we knew the recommendation is up to 12 weeks. There is absolutely no harm to extend. In fact, it will give you better protection up to 12 weeks.
Right. Wanjege Maina, are there any effects if I don't take the second AstraZeneca jab?
If you don't take the second AstraZeneca jab, then your protection starts waning off. Basically, these vaccines, the COVID vaccines, remember their primary mode of action is to prevent you from developing severe disease. When you get the first dose, you get some protection. It has been estimated to between 60 to 76%. And now when you get the second dose, the immune response is more, the protection increases, but more critical is the duration of protection that you are going to get. The second dose will protect, the first dose may protect you up to 4 months, then the other one will. But a lot of this, again, is, remember these vaccines are just 4 or 5 months in use, so it's being monitored. But basically for COVID vaccines, the second dose extends your level of protection.
Right.
So if you only take one, especially after any time after the 12 weeks, then your protection starts getting less and less.
Ngati Alwala, in the next 2 years, we will have a more potent vaccine. What will happen to those already vaccinated? Perhaps asking, can you be revaccinated if we get a better vaccine?
Even as it is now, we do not know for how long the current COVID-19 vaccines will protect you. As I've said, the very first people to be vaccinated was in December of last year in Europe and in the US. So many of the data is just now like 4 or 5 months. I know they are predicting models which are indicating that we could be having protection for 1 year. You've already heard Pfizer saying there will be need for a third dose, specifically when we are not yet clear. But so basically what we need to appreciate that this could even become an annual exercise. And this is even getting more important given that we are having changing variants. Just like the flu, you've been getting people who get their annual flu jab. And if you are keen or if you ask your doctors, they will tell you this year the flu jab is different from the one used last year, depending on the variants.
There's a question here, and it has come up severally on various platforms. Ustad Bai, most of the women who took the first jab did not experience their periods thereafter. Something is wrong. So major concern here is that those women who have been vaccinated, there are reports that their menstrual period is altered. Are these reports that we've gotten, or are we monitoring this situation?
Yes, let me start by assuring Kenyans that as part of the approval by the Pharmacy and Poisons Board, the introduction of this vaccine requires a very close monitoring of known side events or side effects, and even the rare ones which may not have been documented, we are out monitoring them. We do have a system in which we've asked everybody who is vaccinated, if you feel that you have something severe, whether it is fever, whether it is headache, immediately after that, kindly go back to the health facility report. The healthcare workers are taking that information and they are transmitting it to the Pharmacy and Poisons Board. Alternatively, you go to the Pharmacy and Poisons Board website and you'll get a portal where you report those side effects. They will take all your details, your age, your sex, when you are vaccinated, at which post with date of vaccination, and you can describe your side effect. The same thing even within the rural area. So when the pharmacy board gets that, they are able to classify them. They then start doing a follow-up. Yeah. If there are serious side effects, they go and further investigate what is exactly happening. If they are not resolving, then this is reported. And if it is deemed to be a severe side event, then these reports are consolidated and given to a team known as the Kenya National Immunization Safety Advisory Committee. Right. That is very independent. And what they do is to try and see if there's a linkage between those side effects with the vaccine, if there's any direct cause, or if it could be coincidental. So let me specifically then answer the issue of missing periods. I would urge those women to quickly report to the Pharmacy and Poisons Board or to the facility where they were vaccinated, so that can be followed up. Right. Because there are other causes of irregular periods. There are other causes. It could even be the medications that they started taking. It could also be because the other one, or missing period, could be because they have gotten pregnant. And other causes that would make you miss the periods. But what is important is that this has to be investigated so that you rule out all those other causes and then see if it is directly linked to the vaccine.
Right. Thank you for clearing that up. It's been quite a concern among women. Anthony Muhuma asks, do we have cases where those already vaccinated contracted the COVID-19 virus, and how did they recuperate differently, or if they all did not contract at all? Vaccination versus contracting the virus.
That's a very important question, and I think it carries a very fundamental principle we must know. These vaccines do not stop transmission of the virus. They don't stop you from passing the virus to the next person. Now there's a lot of evidence that this virus is really airborne. So the vaccine does not stop. The vaccine stops you from getting severe disease, hospitalization, and death. So since we started vaccinating, the monitoring and evaluation team now is putting in protocols to start seeing the impact. So what we expect to see is that among the people that are going to be hospitalized, majority of them may be the unvaccinated group. Those vaccinated will not form the biggest group within those being admitted. But this is something that is going to be monitored as part of the M&E plan of the deployment plan, where especially from April, when now we started scaling up. We want to follow this through the months, and we have been in discussion as to whether this is a parameter now that will be, once you are admitted, you'll be asked, were you vaccinated, when were you vaccinated, and if you have evidence that you are vaccinated, so that we are able to show that. We expect, and I think in other countries that have actually vaccinated, the admissions is massive reduction. There are very few of the vaccinated that are ending up. So you'll get the disease, there will not be severe symptoms.
All right. How long will we take, I think, as a country to vaccinate the entire Kenyan population? What are our projections?
So let me answer this by saying, as is currently, the vaccine that we are using, AstraZeneca, is only authorized for use in populations above 18 years. So with the estimated number population in Kenya of the adult population is 25 million Kenyans. Now, you remember earlier, given the circumstances of supply chain constraints, we had stretched our deployment plan to the year 2023. But following a number of discussions within government, we are now reducing this so that we aim to vaccinate as many adults, Kenyans, between now and June of next year. And that is why the number of vaccines that we are now going to procure from especially both COVAX and the AU mechanism, we are looking at getting nearly 24.5 million doses, which should be enough to cover the 25 million Kenyans by June of next year. So that is one part. So when we do that, that is 50% of the population. So what do we do then with children? The good thing is that now data on the use of some of these vaccines among children has started coming in. Pfizer, for example, has authorization up to 16 years. But I saw they have also presented data of even up to 12 years. That is still being evaluated. Why these vaccines are not being used in children is just because the data was not there, not because there is no. So as the data is analyzed, then authorization is given. So we are expecting, especially in the coming year, to see other vaccines also getting authorization for use among the young people.
And I'm glad you've mentioned the issue of children, because there was a question of safe vaccines for children. And I'm glad you've covered that. The myth around AstraZeneca not being admissible to people allergic to eggs without providing an alternative option by MOH for Kenyans. Can people allergic to eggs take the AstraZeneca? And if not, what alternative is there for this group of people?
The answer to that question is this. If you are allergic to eggs, you are eligible to be vaccinated with AstraZeneca vaccine. There is no contraindication to that. And I really need to emphasize that and explain. AstraZeneca does not contain the egg protein. Vaccines are made using different formulations and bases. And so some vaccines can be made from eggs. So there will be a contraindication for that specific one. But AstraZeneca does not is not made of any egg protein. So what we've advised is, if you are allergic to other issues, severe allergies, discuss with your doctor. Discuss at that point before vaccination. But egg allergy is not a contraindication. But other vaccines may be made of eggs. When they come, we will let Kenyans know. So please, don't fear to be vaccinated if you have egg allergies with AstraZeneca.
Sarah Joy Malaba on Twitter asked, please ask Dr. Akhwale to demystify the mechanism of mRNA vaccines and the rumor around terminator traits.
I know the issue of the nucleic acid vaccines, as you call them, mRNA, that the initial fear was that this would be able to penetrate certain tissues and organs and alter the gene. This is not really the case, and it's not the case. I think if you do some little bit of Googling, especially when these vaccines are being undergoing through phase 1A, phase 1B, 2A, when you are still looking for safety, and you use the animal model, the development of mRNA ensured that that strand is not able to penetrate the organs that people were fearing it would penetrate. And there's evidence that it was developed in such a way that that would not happen. So there should be no fear that messenger RNA and nucleic acid will do that. In fact, there is a lot of potential on the technology used to develop the nucleic acid, that this is what is going to be used to develop many other vaccines against many diseases.
Right. We're almost done here, but quick last one perhaps. Can we see cross-vaccination of vaccines in the near future? Is it a likelihood?
If the science dictates and gives us evidence, yes. Currently, there is no scientific evidence to that effect of mix and match. But I know there are people, there are groups of scientists really trying to do that. And if the data will then really show that, we could potentially see the world moving. But for us in Kenya right now, we will stand and stick by science. There's really no evidence, and if it is available, we will be evaluating it. We will be asking our technical advisors to review and guide us. So for the time being, and a very important point, for those who have got the first dose of AstraZeneca, you'll get the second. The Pfizer and the Johnson is not going to be a second dose.
Okay. Yeah. That would be for anyone who hasn't been vaccinated yet, I imagine. It would be very unfortunate and unfair for me to end this without asking this question. Janice from Gilgil asks, is there a vaccine in Kenya known as Covishield? Because I received it today.
Oh, absolutely. And it's good. Covishield is the AstraZeneca vaccine. So when this vaccine was developed, it went through, it had a name called Chadox, and then it was developed by the University of Oxford. So it began as Oxford AstraZeneca. In Europe, it is known as Oxford, but AstraZeneca rather. But when it's produced in India, it is called Covishield, the same thing.
Yesterday, and this is my last question to you because we really need to wind up, CAS Dr. Mercy Mwangange said Kenya is considering partnering with other countries for its supply of vaccines and not just India. Talk to us about that. What countries are this we are considering talking to?
There's been a lot of interest by various countries in terms of partnering with us. I know China has spoken to us, Korea has spoken to us. We are also talking to even the AstraZeneca, for example. I know there's, which is the other, Cuba has also written to us. We are going to talk to them. So a number of countries want that partnership. One, in terms of, it could be in terms of getting the vaccines, but our focus is also a lot towards the manufacture of the vaccines.
Right. Well, we'll see how that goes. I hope it will bear fruit. Dr. Akhwale, thank you so much for coming in and responding to some of the questions from Kenyans. There were so many. Unfortunately, we couldn't respond to all of them, but we've really tried to group the questions into what has been frequently asked by Kenyans. And those that you asked, we pose them to Dr. Akhwale. Dr. thank you very much for joining us. Hope to have you next time. It's a fluid situation, so we continue to keep an eye on. Dr. Willis Akhwale is the chairperson of the COVID-19 vaccine deployment and vaccination task force, and we thank you for being present on the show with us here tonight. Well, let's take a look at what we will be waking up to tomorrow morning on our standard newspaper that I must say you should not miss. They went after, that's the Financial Standard, that is pull out on our standard newspaper tomorrow morning. They went after pennies. They ended up with billions. That's the big story on our Financial Standard tomorrow morning. So be sure to get a copy of that. For that story, there's another story on Safaricom CEO Les digital business agenda to steer company into new territory. There's been a lot of controversy, questions and concern around this. So I believe there will be an explainer to what just is Safaricom doing. And of course, you will get some of your answers from that report. That and more stories on your Financial Standard that you will get on your Standard newspaper tomorrow morning. Thank you for joining us here on KTN Prime. Glad you could be here. Thank you for engaging with us. And I hope your questions to Dr. Akhwale were answered satisfactorily. I am Akisa Wandera. Sign language interpreter is Meresha Owiti. Robinson Okenye comes in next with the FKF PL Review Show. So everything Kenyan football, be sure to join him and his panel for that conversation. Have a good night. I'll be seeing you tomorrow night on the front row.